This video will be one of a three-part series where I'm going to go over frozen shoulder. What is it, and then how can we treat it through each phase? The first video is going to be in the freezing stage, second video is frozen, and the last video is going to be in the thawing stage. So frozen shoulder, the term was coined by Dr. Codman in 1934. What he noticed was it's a marked reduction in shoulder elevation, or the ability to raise the arm up overhead, as well as external rotation, or the ability to put your hand back behind your head. And there's really not a lot of good evidence that supports why this happens. In some cases, it's thought to just be from trauma, inflammation, autoimmune disease, different things like that. It's more common in people greater than 40 years old. It's more common in females, and also it is a higher prevalence in people that have diabetes type 2. And one of the things that also is known about this condition is no matter what you do, it seems like it has to go through the three phases of the process in order to fully resolve. So the best thing that we can do is how to manage it, mitigate it, and try to reduce some of the symptoms and kind of the collateral damage, so to speak, some of that additional loss of range of motion as you go through the program. So in this first video, we're going to go over the freezing stage. In the freezing stage, you're going to have a lot of pain. This is the most painful stage of all three of the stages. A lot of shoulder pain. So one of the things we want to work on is pain reduction as much as possible. That can be using moist heat or cold packs, whichever you prefer, as well as performing range of motion exercises. If you have a TENS unit, you're safe to use that, or some sort of electric stim or vibration unit, those types of things, and your doctor is okay with that. Of course, you can use those things during this phase or throughout the entire program. But for our purposes of the video, we're going to assume that maybe all that you have is some moist heat or maybe an ice pack. So definitely do that as much as you can throughout the day to try to calm down the pain as much as you can. We're going to start first with going through range of motion with a tabletop slide. I'm going to use this pillowcase. I'm a big fan of this exercise. I think it works really well. And there's two versions of this that we can do. So we're going to say it's my right shoulder that is inflamed. This is my shoulder that's freezing. I'm going to put it down, take my other hand, put on top. I'm going to work on sliding forwards. You can do this on top of a tabletop or a counter, just a stable surface. I'm going to slide forwards again. I'm using my left arm to kind of pull my right arm forwards. Now also with this, if this is really painful and you're having a day where this is really too painful for you to actively do that, what you can do is find a spot out here on the table, kind of stabilize with my left hand on top of that right hand, because remember, it's my right side that's affected, and I'm going to back away and lean forward. So I'm not actually moving my hand, I'm just stepping backwards and kind of leaning forwards. And you see what I would be doing is bringing my arm up in that position. So I'm going to lean back, and I do that for maybe 10 to 15 repetitions, even 20 or 25 repetitions if you can. This is something that you want to perform multiple times a day. This is 5, 6, 7 times a day if possible. We want to maintain that range of motion. Again, making sure that when you go forward, you go as far as you can. If it's too painful, then obviously back off, but really try to push it and get as much range of motion as you can each time that you perform that exercise. The next thing we're going to do is work on some shoulder strengthening. So we can do this two ways. We can start off if it's really inflamed and this is super painful, you just can't bring your arm out to the side like this. You can do the walkouts or step outs. I'm going to tuck my elbow in nice and tight. I'm using a band here that's fastened, not too strong, just something that's a little bit of resistance, and I'm going to step out to the side and then step back in, step out to the side. I'm having to maintain my arm in this position instead of going through that active movement. I perform that for 1 to 2 sets, 10 to 15 repetitions, just like the tabletop slides, several times a day. Now, if you are able to tolerate, then you can go out in this position. This is external rotation. You're going to feel that on the back of the shoulder, really working those muscles, those rotator cuff muscles, and all on the back side. So you can do that for the same amount of repetitions and sets, 1 to 2 reps or 1 to 2 sets, 10 to 15 repetitions. If you want to go a little higher, that's fine. It's just really up to you. This is going to increase your pain. It's normal to have pain increases with this. Just make sure you aren't doing so much that it increases your pain such that you can't function on a daily basis. Next, we're going to work on scapular retraction. So what you're going to do is take that same band, pull it back, keeping the elbow kind of tucked in here as far as you can. 1 to 2 sets, 10 to 15 repetitions. You can perform more sets and repetitions, just like I said before. Just don't over-irritate this area. And when I go back, I really think about squeezing my right shoulder blade, pulling it around towards my spine, nice and controlled. And with this exercise, just like the one where I went out to the side with that external rotation, you can just statically hold the elbow in, step back, you feel that pull, you maintain everything in position, step back forwards. You step back again, and then step back forwards. That's a great way to basically perform that in an isometric fashion. Now we're going to work on internal rotation. I've got my elbow tucked in here. We're going to start first with that isometric. I'm just going to step out, maintain this position, step back in, step out, maintain the position, come back in. If your pain allows, then you can perform this isotonic or more of an active movement. Just going to bring it in, pulling it in, completing 1 to 2 sets, 10 to 15 repetitions, nice, slow, and controlled. Next, you're going to perform scapular protraction. So what you're going to do with this one is you're going to push forwards. So again, just like the other exercises, if you can't do that, it's too painful, keep the elbow right here, tucked to your side. You can have palm down, palm in neutral position, palm facing up, just whichever feels best to you. It doesn't really matter to me. And you're just going to step forwards and then step back, step forwards and then back. Again, if you're able to do that with your pain, then you're going to push all the way out straight forwards, 1 to 2 sets, 10 to 15 repetitions, nice, slow, and controlled. Our last exercise is going to be a shoulder abduction movement where I'm going to come out to the side. Now this is not going to be a pure abduction movement, so I'm not going to go straight out to the side. It's really more of scapular plane, so I come a little bit forwards instead of straight out to the side. We're really trying to work that supraspinatus rotator cuff muscle as well as the deltoid. I'm going to bring it out to the side just like this, 1 to 2 sets, 10 to 15 repetitions. But just like the other exercises, if that's too uncomfortable, what you can do is go to your feel tension. I've got my arm here by my side, and I'm just going to step out the same way as I did before, 1 to 2 sets, 10 to 15 repetitions. Now that we performed our initial range of motion movement, we went through our strengthening exercises, we're going to finish up with our cane flexion or elevation exercise as well as our external rotation. So this is a piece of PVC pipe. You can use a walking cane, you can use a broom handle, just really whatever you have that will work. And you can incline yourself up with pillows, kind of prop up a little bit. I'm going to go back as far as I can overhead. I'm going to hold that stretch maybe for 2 to 3 seconds, come back down. I'm going to come back up again, hold that stretch 2 to 3 seconds, and then come back down. And what you'll notice is I have my knees bent in this position because I only want to come down to the point where my knees are bent. And that's just my preference. And some people would lie all the way flat. They'll come all the way back down, come all the way back up. But been my experience with patients, when you're all the way flat or if my knees weren't here, when you bring your arm down at the bottom of that range of motion, it can be a little uncomfortable for the shoulders, maybe more so than it's already hurting. So I just like to start with that, almost like a partial repetition. We'll just kind of go from the tops of my knees, back as far as I can, and then back down. And I complete that for 1 to 2 sets of 10 to 20 repetitions. Our last movement is going to be an external rotation and abduction kind of combined movement. I'm going to take my hand here on the end of the cane. I'm going to bring my elbow out as far as I can out to the side, and then I'm going to push back. So my hand looks like it's in this position, like I'm going to throw a baseball or a softball overhand. I'm just going to go back, hold that stretch 2 to 3 seconds, and then come back down. And you're really going to feel that in your pec. You're going to feel that in the armpit area. That's normal. You're just going to push back as far as I can, hold that stretch, and then come back down. A lot of people with that will straighten out the elbow, which that's not a bad stretch. It almost turns into like a shoulder distraction stretch. But I just prefer to try to keep the elbow bent as much as you can with that, kind of at a right angle, to go back, hold that stretch 2-3 seconds, and then come back down. Thanks so much for checking out this video. This is phase 1 or part 1 of the 3 parts or 3 phases of frozen shoulder.